What if saving your natural tooth is actually better than removing it, but only if you know the right questions to ask? If a dentist has recently told you that you need a root canal, or if you're worried this might be in your future, I want you to stay with me for the next few minutes, because what I'm about to share could change the way you think about this whole topic. Hello, I'm Dr. Alan Mercer. For more than 35 years, I've cared for older adults, helping them navigate everything from heart health to memory concerns to the many small decisions that add up to a longer, healthier life. And I can tell you, one of the most common sources of anxiety I see in my patients over 60 isn't a serious diagnosis. It's 4 simple words from their dentist: you need a root canal. I understand why. Many of us grew up hearing frightening stories about root canals. Maybe a parent or grandparent had a bad experience decades ago, back when dental treatment looked very different than it does today. Maybe you've read something online that made your stomach drop. Whatever the reason, by the time many of my patients sit down in my office, they've already convinced themselves this is going to be one of the worst experiences of their life. So today I want to walk through this topic with you honestly, calmly, and thoroughly. We're going to separate the myths from the facts. We're going to talk about what actually happens during this procedure, how it compares to pulling a tooth, what conditions common in older adults might affect your treatment, and the questions you should ask before agreeing to anything. My goal isn't to tell you what to do. That decision belongs to you, together with your dentist or endodontist, who is a dentist with additional training in exactly this kind of treatment. My goal is simply to make sure you walk into that conversation informed and not afraid. Let's start with the basics. What exactly is a root canal? Inside every tooth, beneath the hard white enamel and a layer called dentin, there's a soft area called the pulp. This pulp contains nerves, blood vessels, and connective tissue. It's what helped your tooth develop when you were young. In an adult tooth, though, the pulp isn't strictly necessary for the tooth to keep functioning day to day, because the tooth continues to receive nourishment from the surrounding tissues. Sometimes, because of deep decay, a crack, repeated dental procedures on the same tooth, or trauma, that inner pulp becomes infected or inflamed. When that happens, it can cause significant pain, and if left untreated, the infection can spread. A root canal, more accurately called root canal therapy, is a procedure where the dentist or endodontist removes that damaged pulp, cleans and disinfects the empty space inside the tooth, and then fills and seals it. Afterward, the tooth is usually protected with a crown to restore its strength. In plain English, it's a way of removing the source of infection while keeping your natural tooth in your mouth, rather than removing the tooth entirely. Now here's something many people don't realize. The procedure isn't what typically causes the pain associated with root canals. It's the infection that was already there before you ever sat in the dental chair. Current evidence indicates that patients often feel significant relief once the infected tissue is removed, because that's what was actually causing the discomfort in the first place. Let me tell you about one of my patients, a woman named Margaret, 72 years old, retired school teacher, sharp as a tack. Margaret came to see me not for dental reasons, but for her blood pressure. During our conversation, she mentioned she'd been putting off a root canal her dentist recommended for nearly 8 months because a friend had told her it would be excruciating. She was living with a dull, aching pain in her jaw that had become her new normal. When I asked her to describe her day-to-day comfort level, she admitted she'd stopped eating on that side of her mouth entirely. She'd adjusted her whole diet around a tooth she was avoiding. That's actually more common than people think, and it's one of the reasons I wanted to make this video. So why do dentists recommend this procedure in the first place, instead of simply removing the tooth? There's a principle in dentistry, much like in medicine generally, of trying to preserve the body's original structures whenever it's reasonably possible. Your natural teeth are remarkably good at their job. They're anchored into your jawbone by a ligament that provides sensory feedback, helping you sense pressure and adjust your bite automatically, something artificial replacements can't fully replicate. Keeping a natural tooth, when it can be saved, often helps maintain the alignment of neighboring teeth, supports proper chewing function, and can help preserve your natural bite pattern and facial structure. Research suggests that when appropriate, treated teeth can continue functioning for many years, often decades, when properly restored and maintained. That said, and I want to be very clear about this, a root canal isn't automatically the right choice for every situation. There are cases where extraction, meaning removal of the tooth, is genuinely the better path forward. We'll talk about how that decision gets made a little later. Let's talk about what actually happens during the procedure itself, because I think understanding the process removes a lot of the fear around it. Typically, the area around the tooth is numbed thoroughly with local anesthetic, similar to what's used for a filling. Many patients tell me they feel less during a root canal than they expected, largely because modern anesthesia techniques have improved so much since the procedures our parents or grandparents may have experienced. Once the area is numb, the dentist or endodontist creates a small opening in the top of the tooth to access the pulp chamber. Using very fine instruments, they remove the damaged or infected pulp tissue. The empty canals inside the tooth root are then cleaned, shaped, and disinfected. After that, they're filled with a biocompatible material to seal the space and prevent future infection. Finally, depending on the tooth and how much natural structure remains, a filling or a crown is placed on top to restore the tooth's strength and function, since teeth that have undergone this procedure can become more brittle over time. Most root canal procedures on a single tooth take somewhere between 60 and 90 minutes, though this varies depending on the tooth's location and complexity. Molars, for example, generally have more canals than front teeth, which can make treatment a bit longer. Now, let's address the question I know is on many of your minds. Does it hurt? This is where I want to gently push back on the old reputation root canals carry. Studies have found that with modern local anesthesia and technique, patients undergoing root canal treatment generally report discomfort levels similar to, or sometimes even less than, getting a filling. The intense pain people associate with root canals is very often actually the pain of the untreated infection beforehand, not the treatment itself. After the procedure, it's common to experience some soreness or sensitivity for a few days, similar to what you might feel after other dental work. This is typically manageable with over-the-counter pain relief as recommended by your dentist. If pain becomes severe or worsens rather than improves after several days, that's something to report to your dentist promptly, as it could indicate a complication that needs attention. Let me tell you about Robert. Robert was 69, a retired truck driver, built like someone who'd spent his whole life doing physical work and not complaining about much. Robert told me flatly that he'd rather have a tooth pulled than go through what his uncle went through back in the 1970s. I asked him what his uncle experienced, and he described a procedure performed decades ago, before modern anesthesia techniques and imaging technology existed in their current form. I explained to Robert that dental medicine, like the rest of medicine, has changed enormously. Eventually, Robert did have the procedure done after a long conversation with his endodontist about what to expect. He told me afterward that the appointment itself was almost anticlimactic compared to what he'd built up in his mind. This brings me to the myths, because there are quite a few floating around, and I think it's worth addressing them directly and respectfully. The first myth I hear often is some version of root canals cause illness elsewhere in the body, sometimes tied to concerns about bacteria being sealed inside the tooth. This idea traces back to a theory from roughly a century ago that has since been extensively studied and is not supported by current dental and medical research. Major dental and medical organizations, based on decades of scientific study, do not find credible evidence linking properly performed root canal treatment to disease in other parts of the body. I say this not to dismiss anyone's concerns, because I understand why the idea feels compelling, but because I care about you making decisions based on solid evidence rather than outdated theories. The second myth is that you should simply pull any tooth that has a problem rather than trying to save it, because it's simpler. Extraction is sometimes appropriate, and we'll discuss when, but it isn't automatically simpler or better for your long-term oral health. Removing a tooth creates a gap, and that gap can lead to other teeth shifting, changes in your bite, and potential bone loss in the jaw over time in that area. Sometimes the tooth then needs to be replaced with a bridge or an implant, which is often a more involved and costly process than the root canal would have been in the first place. The third myth is that root canals never really work, and the tooth is going to fail anyway. Current evidence indicates that root canal treatment has a high success rate, and many treated teeth continue functioning well for years or even decades afterward, particularly when they're properly restored with a crown and the patient maintains good oral hygiene and regular dental visits. Let me share Helen's story here. Helen was 77, a retired librarian, and one of the most thoroughly researched patients I've ever had the pleasure of treating for anything. Helen had read extensively about the outdated theory linking root canals to systemic illness, and she came to our appointment with printed articles, genuinely worried. Rather than dismiss her concerns, we went through the current research together. I explained that scientific understanding evolves and that what seemed compelling 100 years ago, before modern research methods and diagnostic tools existed, doesn't hold up under today's stricter scientific standards. Helen appreciated being walked through it rather than simply being told she was wrong. She went on to have the procedure and, months later, told me she wished she hadn't spent so many sleepless nights worrying beforehand. Now let's talk honestly about root canal versus extraction, because this is genuinely one of the most important decisions you might face. Choosing a root canal, when appropriate, generally means keeping your natural tooth, preserving your natural bite and chewing ability, and avoiding the need for a replacement tooth. Potential downsides can include the cost of the procedure itself, the need for a crown afterward in many cases, and the possibility, though not the certainty, that the tooth could need additional treatment down the road if a new problem develops. Choosing extraction means removing the source of infection more immediately and can sometimes be less expensive up front. However, it typically means you'll eventually need to consider a replacement, whether that's a bridge, a partial denture, or a dental implant, in order to maintain your ability to chew properly and to prevent shifting of your other teeth. Without a replacement, extraction can also contribute to changes in jawbone density in that area over time, since the bone in that region relies partly on the pressure from chewing to stay healthy. There's no universal right answer here. It depends on the specific tooth, how much natural structure remains, your overall health, your budget, and your personal priorities. This is exactly the kind of decision where I encourage my patients to have an honest, unhurried conversation with their dentist or endodontist, asking about the pros and cons specific to their situation. Let me tell you about Frank. Frank was 66, recently retired from a long career in construction management, a very practical, numbers-oriented man. Frank initially wanted to simply pull a problematic molar because it seemed like the more straightforward option. His dentist recommended a root canal instead. Frank came to me somewhat frustrated, wanting a second opinion on whether this was truly necessary or whether the dentist was simply trying to generate more billable work. I explained to Frank that as a physician, I couldn't evaluate his tooth directly, that's outside my scope of practice, but I encouraged him to ask his dentist very specific questions. What happens to the neighboring teeth if this one is pulled and not replaced? What would a replacement cost and involve compared to the root canal? Frank went back, asked those exact questions, and ultimately decided the root canal made more sense for his particular situation. He later told me that simply understanding the reasoning behind the recommendation made all the difference in how comfortable he felt moving forward. Now, some of you may be wondering about dental implants specifically, since they're often mentioned alongside root canals and extractions. A dental implant is essentially an artificial tooth root, typically a titanium post, that's surgically placed into the jawbone, with a replacement tooth attached on top. Implants can be an excellent option in the right circumstances, but they are their own major decision, involving surgery, healing time, and a completely different set of considerations than a root canal. I am not a dentist, and I want to be honest with you about that. I cannot tell you whether an implant is right for your particular tooth, your bone density, or your overall dental situation. What I can tell you is that this is a conversation worth having directly with your dentist or an oral surgeon who can evaluate your jawbone, your gum health, and your overall dental picture using imaging and examination tools that I simply don't have access to as a physician. Generally speaking, dentists tend to consider factors like the health of your remaining jawbone, whether you have adequate bone density to support an implant, your gum health, and your overall medical history when discussing this option with you. Let's Let's shift now to talk about how aging itself changes the picture when it comes to dental health, because this is really at the heart of why I wanted to make this video for this particular audience. As we age, several things happen inside our mouths. Saliva production can decrease, which affects your natural defense against decay-causing bacteria, since saliva helps wash away food particles and neutralize acids. Gum tissue can recede over time, exposing more of the tooth root, which is softer than the enamel-covered crown and more vulnerable to decay. Many older adults have also accumulated decades of dental work, fillings, crowns, and previous root canals. And older dental work can sometimes weaken or fail over time, requiring additional treatment. None of this is meant to alarm you. It's simply the reality of how our bodies, including our mouths, change as we get older, and it's exactly why regular dental checkups become even more valuable as the years go by, not less. I also want to spend some time talking about how certain health conditions and medications common among older adults can factor into dental treatment decisions, because this is an area where your physician and your dentist really need to be working from the same information. Let's start with diabetes. Studies have found an association between diabetes and increased risk of gum disease and other oral health complications, partly because elevated blood sugar can affect healing and immune response. If you have diabetes and you're facing a root canal or any dental procedure, it's important that your dentist knows your current blood sugar control and that you keep your physician informed as well. Well-managed blood sugar generally supports better healing outcomes after dental procedures, so this is genuinely a case where your diabetes care and your dental care intersect directly. Next, blood thinners. Many older adults take medications like warfarin or newer anticoagulants, often for conditions like atrial fibrillation or a history of blood clots. If you're on a blood thinner, it's essential that your dentist and your prescribing physician are both aware before any dental procedure, including a root canal, because these medications can affect bleeding and clotting during treatment. In most cases, your physician and dentist will coordinate to determine whether any temporary adjustment is appropriate, and I want to be very clear, you should never stop a prescribed blood thinner on your own without speaking to the physician who prescribed it, as doing so can carry serious risks of its own. Then there are osteoporosis medications, particularly a class of drugs called bisphosphonates, which many older adults, especially women, take to help maintain bone density. There has been research into a rare but serious complication associated with these medications affecting jawbone healing after certain dental procedures, sometimes called medication-related osteonecrosis of the jaw. This appears to be more strongly associated with extractions and jaw surgery than with root canal treatment itself, and current evidence suggests the risk with oral bisphosphonates taken for osteoporosis is generally low, but it's still an important conversation to have. If you're taking any osteoporosis medication, make sure both your prescribing physician and your dentist know, so they can discuss your specific risk factors together. Dry mouth, medically referred to as xerostomia, deserves its own mention because it's extremely common among older adults, often as a side effect of medications used to treat blood pressure, depression, allergies, and many other conditions. Reduced saliva flow can increase your risk of tooth decay and gum disease, which in turn can increase the likelihood of needing procedures like root canals in the first place. If you're experiencing persistent dry mouth, mention it to both your physician and your dentist. Sometimes a medication adjustment is possible, and your dentist may also recommend specific products designed to help manage dry mouth and protect your teeth. Gum disease, or periodontal disease, is another factor worth understanding. It's an infection of the tissues that support your teeth, and it becomes more common with age. Advanced gum disease can complicate dental treatment planning generally, including decisions about whether a tooth is a good candidate for a root canal versus extraction, because the health of the supporting gum and bone tissue matters for the tooth's long-term prognosis either way. Let me tell you about Dorothy. Dorothy was 81, still living independently, wonderfully sharp, and managing several health conditions, including osteoporosis and mild diabetes. When her dentist recommended a root canal, Dorothy came to me first, worried about how her medications might interact with the procedure. We had a thorough conversation, and I encouraged her to bring a full list of her current medications to her dental appointment and to make sure her dentist was in contact with me if needed. That kind of coordination between physician and dentist is something I always encourage, particularly for patients managing multiple health conditions. Dorothy's treatment went smoothly, and her endodontist was able to plan appropriately with her full medical picture in mind. Now, I mentioned earlier that saving a tooth isn't always possible, and I think it's important to be honest with you about that too, rather than pretending every tooth can always be saved. Sometimes a tooth has such extensive decay or damage that there isn't enough healthy structure remaining to support a restoration, even after root canal treatment. Sometimes a tooth has a vertical fracture extending down into the root, which generally cannot be repaired. Sometimes the surrounding bone has been so significantly affected by advanced gum disease that the tooth's long-term prognosis is poor, regardless of what's done to the inside of it. In situations like these, your dentist may recommend extraction, not because it's the easier path, but because it may genuinely be the more appropriate one for your specific circumstances. This is precisely why I always encourage patients to ask their dentist directly. What is the long-term prognosis for saving this tooth, realistically? A good dentist will give you an honest answer, rather than simply pushing you toward one option or another. I also want to make sure you know the warning signs that mean you should seek dental or medical care urgently, not wait for a routine appointment. These include significant facial swelling, particularly if it's spreading or affecting your ability to open your mouth fully, a fever accompanying dental pain, difficulty swallowing or breathing, severe, worsening pain that isn't controlled by over-the-counter pain relief. Any of these symptoms can indicate that an infection is spreading beyond the tooth itself, which can become a serious medical situation requiring prompt attention, sometimes even emergency care. Please don't wait these symptoms out at home. Contact your dentist immediately or seek emergency care if your dentist isn't available. Let me tell you about George. George was 74, a proud man who generally avoided doctors and dentists whenever possible, describing himself as someone who toughs things out. George developed a toothache that he initially ignored for almost 2 weeks. When his cheek began to visibly swell and he developed a low fever, his daughter finally convinced him to be seen. It turned out George had a spreading dental infection that required urgent treatment. He recovered well, but he later told me that the delay had been driven purely by stubbornness and a bit of fear, and that he wished he'd sought care the moment the pain started rather than waiting for things to escalate. George's story is a good reminder that dental pain is your body's way of telling you something needs attention, and it's generally better addressed sooner rather than later. Let's talk now about recovery after a root canal, since this is often on people's minds heading into the procedure. Most patients can return to normal activities the same day or the next day. Mild soreness around the treated tooth and surrounding gum tissue is common for a few days afterward and generally improves gradually. Your dentist will typically recommend over-the-counter pain relief as needed and may provide specific instructions depending on your particular situation. It's generally wise to avoid chewing directly on the treated tooth until any temporary filling is replaced with a permanent restoration, since the tooth can be more vulnerable to fracture during this window. In terms of foods, immediately after the procedure, while you're still numb, it's best to stick to soft foods that don't require much chewing on that side. Things like soup, yogurt, mashed potatoes, scrambled eggs, or a smoothie. This isn't just about comfort, it's also to avoid accidentally biting your cheek or tongue while you're still numb and can't feel it properly. In the days following, many patients find it comfortable to continue favoring softer foods and to avoid very hard, crunchy, or sticky foods like nuts, hard candy, or caramel on the treated side until their dentist confirms the tooth has been fully restored, usually with a permanent crown. Let me share Eleanor's experience here, since I think it's a helpful, ordinary example. Eleanor was 70, a retired nurse herself, so she approached the whole process with a fairly clinical, practical mindset. She told me her biggest surprise was how uneventful her recovery actually was. She'd expected days of significant pain based on old stories she'd heard, but described her actual experience as a bit of soreness, similar to a filling, gone within a few days. She specifically mentioned being grateful she'd stocked her freezer with soup beforehand because she genuinely didn't need much beyond that. Now let's talk about how you can help reduce the likelihood of needing procedures like this in the future, because prevention really is at the heart of good dental health at any age. Regular dental checkups and cleanings, generally recommended twice yearly for most adults, though your dentist may suggest a different schedule based on your individual needs, allow small problems to be caught and addressed before they become larger ones. Consistent brushing, generally twice daily with fluoride toothpaste, and daily flossing or use of interdental cleaners help remove the plaque that leads to decay and gum disease. If you're experiencing dry mouth, discussing management strategies with your dentist and physician can meaningfully reduce your decay risk. Limiting sugary and acidic foods and beverages and staying well hydrated also supports oral health. And perhaps most importantly for this conversation specifically, addressing dental concerns promptly rather than postponing them out of fear or discomfort tends to lead to simpler, less invasive treatment in the long run. Before we wrap up, I want to give you a practical list of questions worth asking your dentist or endodontist if you're facing this decision. What is the long-term outlook for saving this particular tooth? What would happen if I chose extraction instead, both in the short term and years down the road? Will I need a crown afterward, and what does that involve? How does my diabetes, my blood thinners, my osteoporosis medication, or any other condition I have factor into this recommendation? What are the costs involved with each option, including any follow-up treatment? And how many similar procedures have you personally performed? There's no shame in asking that last one. It's your mouth, your health, and your right to feel confident in the person providing your care. As we come to the end of our time together today, I want to leave you with the biggest lessons from our conversation. A root canal, despite its intimidating reputation, is generally a well-tolerated procedure when performed by a qualified dentist or endodontist using modern techniques, and for many patients, it offers a genuine chance to keep a natural tooth functioning well for years to come. The pain people fear is usually caused by the underlying infection, not the treatment that resolves it. Extraction is sometimes the right choice, but it isn't automatically the simpler or better one, and it comes with its own long-term considerations. If you're managing conditions like diabetes, taking blood thinners, or using osteoporosis medications, make sure your physician and dentist are communicating with one another so your care is coordinated properly. And please don't let fear, old stories, or outdated information keep you from seeking treatment when you need it. Delaying care because of anxiety very often leads to a more complicated, more painful situation than addressing the problem early would have. Every person's situation is genuinely unique. Nothing in this video is meant to replace an actual evaluation by your own dentist, endodontist, or physician who can look at your specific tooth, your specific health history, and give you guidance tailored to you. If today's discussion helped you, I'd really appreciate it if you'd like this video and subscribe for more evidence-based health guidance for older adults. This video is intended for educational purposes only and should not replace personalized medical advice from your physician, dentist, or other qualified healthcare professional. Take care of yourself, take care of the people you love, and I'll see you in the next video. This is Dr. Alan Mercer, wishing you strength, health, and many happy years ahead.